Hello, I'm Vasant Andrews. I'm a consultant obstetrician and gynaecologist, and I work at EGynaecologists in Harley Street in central London. I specialise in supporting women with recovery after childbirth, particularly when things don't feel quite as they should. For many women, the focus after childbirth quite naturally shifts entirely to the baby. But your own recovery, particularly perineal healing, is just as important. And too often it does not receive the attention it deserves. Some degree of perineal discomfort is expected in the early days, especially following a tear or an episiotomy. However, when the pain persists beyond the initial healing period or begins to affect your comfort, mobility, or intimacy, it's worth taking a closer look. Women often describe a range of symptoms: ongoing soreness when sitting, a pulling or tight sensation around the scar, discomfort with bowel movements, or pain during intimacy that simply does not resolve with time. While these symptoms are common, they're not something that you should feel obliged to accept as part of motherhood. In my practice, I take a highly individualised and discreet approach to postnatal care. This involves a detailed assessment of perineal healing, scar quality, and pelvic floor function, areas which are only briefly reviewed in routine postnatal care. Where needed, we can offer targeted evidence-based treatments ranging from optimising healing and comfort to specialised pelvic floor therapy, and in selected cases, refined corrective procedures. What's particularly important is timing. Addressing these concerns early not only improves symptoms more quickly, but can also prevent longer-term complications. Many of the women I see tell me they felt unsure about seeking help, or were reassured that things would settle with time. And whilst this is sometimes true, there is also significant value in expert review and reassurance. Ultimately, recovery after childbirth should not be about endurance. It should be about restoration. If you feel that your recovery hasn't been as comfortable or complete as you expected, it may be worth considering a more specialised opinion. With the right care, you can return to feeling entirely yourself again. I offer dedicated, unhurried postnatal consultations with a focus on restoring comfort, function, and confidence. You're welcome to get in touch.